Hello, it's Miss Renee here. This video is produced to provide you a summary of our first lesson. Although it is face-to-face, but the activities that are designed in this lesson is very much of e-learning. And I hope that this video will help you to get a better insight of what exactly this lesson is about. So first and foremost, what are the problems that we faced in our healthcare systems in Singapore? It is not a perfect system, of course, and our demographic changes. So the first problem is aging population, or what we call silver tsunami. So Singapore is aging rapidly, and you're going to see more and more older people in our society, and that is a problem. And the second problem that we have is that the cost of healthcare in Singapore is always on the rise. And because of these two problems, obviously that gives you an opportunity, and that means there will be a bountiful of jobs for you, especially that you are in this diploma in health services management. And because of these two problems, silver tsunami and the rising cost of healthcare, and that's the reason this lesson is being created. This lesson, it is on integrated care. Integrated care is one of the ways the government is doing in order to manage these two problems that I have been talking about. So earlier on we talked about integrated care. So what are we trying to integrate? We are trying to integrate these three levels of care. First is the primary care, second is the secondary care or tertiary care, and the third is community care. And some people call this community care as intermediate long-term care. It means the same. Now, you should know by now clearly what is primary care, because the place that you're staying in Singapore, I'm sure that there is a general practitioner, or we call GP. And some of you may even stay nearer to the polyclinics. So polyclinics, GP are part of the primary care. Secondary care and tertiary care, where you see the public hospitals or private hospitals and some specialist centers like the National University Heart Center. Where else for community care, the nursing homes and also the community hospitals. So these are some of the examples of these three levels of care. And when do you go to a GP or the primary care? Is when you have common illnesses such as fever, cough, flu, diarrhea, stomachache. And when you go to the secondary or the tertiary care, where you're being referred by a primary care doctor, that you need someone who has a depth of knowledge in the particular area. So for instance, you have been suffering a headache, and then you have been also having some ringing in your ears. Your primary care doctors, what we call a GP, might have referred you to see a ear, nose, throat specialist, and this specialist is in the tertiary care in Singapore. And what about an elderly person who has problem doing simple things like bathing and eating? This person will need to go to a nursing home, and this is part of the community care. And when we talk about integrating care, we want these three levels of care to be combined together, such that the information of the patient will flow from one level to another level, so that care can be continued for the particular patient. Our healthcare has certainly evolved over the years. In the beginning, we have 2 clusters, and when we evolved into having 6 regional health systems. And now we are back to clusters, which is only 3 clusters in 2018. This is something that's important, and you need to remember. The 3 clusters comprises of National University Health System, National Healthcare Group, and Singapore Health Services. And in each of these clusters, you can see that the 3 levels of cares are integrated. So for instance, in the West Cluster under the National University Health Systems, you have primary care, this is the tertiary care, and as well as the community care. Likewise for the National Healthcare Group, also 3 levels of care: primary care, tertiary care, and community care. And for these 3 clusters, it is also anchored by a medical school. And talk about problems facing Singapore, which is a silver tsunami. So let's talk about problems typically faced by an elderly. So an elderly typically are very frail and they tend to fall. So when an elderly fall, depending on how serious is the condition, the elderly might end up in a hospital, say Khoo Teck Puat Hospital, because the elderly stays at Yishun. And well, sadly, perhaps they found out that this elderly have a hip fracture. So after an operation to help this elderly to have his hip being mended, this elderly may take some time to be able to walk again and need help from a therapist called physiotherapist. So this elderly will then go to a community hospital so as to regain his mobility and ability to walk again. And after which, depending on the condition of the elderly, if the elderly is still continue to be in a very frail conditions, for instance, not even able to go to the toilet or walk on his own or even eat, then the elderly might be transferred to a nursing home for a longer duration of care. So this is an example of how an elderly would be cared for if the elderly is staying in Yishun, and how the elderly care is being continued from a tertiary care, which is a Khoo Teck Puat Hospital, to a community hospital and soon to a nursing home, depending on the condition of the patient. And continuity is very important so that the elderly is able to get the type of care that he or she needs. Right, this is a very important slide because it gives you all the reasons for our healthcare systems to be transformed into 3 clusters like what we have now in 2018. Largely because of a silver tsunami or aging population, and therefore more elderly will suffer from chronic diseases. What is chronic disease? You need to check out about this on your own. There's a homework for you, and we will delve into this deeper in the upcoming lessons. If our 3 clusters are well integrated, then we can expect to see the benefits of the care being continued. One classic example would be, for instance, I'm being suspected of having anemia, and so the doctors in the polyclinic require me to do a blood test. And well, having a blood test do cause some pain, and depending on how much blood that I can be drawn from me. For the first instance, if the first instance it can't be drawn, then probably the second and third instance. So the blood is finally drawn when I have this blood test being done at the polyclinic. And the doctor suspect that I'll probably have further issues and then refer me to a specialist doctor at Khoo Teck Puat Hospital, for instance. And if the care is being continued, the blood test result of mine, the polyclinic, can be easily transferred to Khoo Teck Puat Hospital, and therefore it saves my time, it saves my money, because I don't need a second blood test being done at Khoo Teck Puat Hospital, unless it is a more advanced blood test so that it can reveal what are the underlying issues that I'm suffering. So this is an example of care of myself being continued. Another example for an elderly would be that the real example I talk about, a frail elderly who had a hip fracture, and if this elderly who had a hip fracture is being discharged prematurely from Khoo Teck Puat Hospital because there are not enough beds in the hospital, then what happens is that this elderly might suffer another fall again at home, and this is something that we want to avoid. So in order for the care of this elderly to be continued, this elderly should be discharged from Khoo Park Hospital to a community hospital so that he can regain the mobility first, the ability to walk again first before going home, so that this elderly is able to maintain his living activities as per normal. So these are two examples. And if this elderly is able to do that, obviously it is less hospitalization episode for this elderly, and also lower the cost of mortality, because the second time an elderly fall, it might be the end, which is something that we very much would like to avoid. So with that, thank you.